TMJ.
And what?
TMJ.
And TMJ. Yeah, kind of a quick TMJ. Tiana, you got. Okay. So let's have you stand here. And well, actually, let me just tell. I'm just first going to get a baseline here. So that's nice and strong. She was all strong before in the clinic. For the most part, everything was tuned up pretty good. But then when she cross crawled, it blew her out. Those are great. Let's test an extensor. Good. Let's test a scaling too. Yeah. So right now she's in top form. Now we're going to cross crawl. Because before you start, because last time she was strong. She cross-crawled like this, she went weak. Everything went weak. She went back to this, everything came back on. Same with that one. So, the cross-crawl, yeah. Everybody feels like cross-crawling as well. It's good for all of us. Make sure you feel this right here. If you really get the cross-crawl mechanism, then you'll really be able to convey it to your patients. And I always do it with my patients. That way they don't feel so. Sitting. That dozen or so. Make sure you're looking out there. Good. You're looking out there. Good. Okay. Now, stop. And let's see what we got. Hey, look at that. So that's good. Good. Mostly rated. So two very different reasons why both you guys had that kind of switching, but it was from two very different sources. Now, you're fine. I mean, you're strong. That cross. Now, I would encourage you and Dale to both do a lot of this for a while. Just make it part of your routine. But watch yourselves. You guys can watch each other. What will happen is you'll be going along and, oh, this is great. All pretty soon there. Because you did that already. And so you got to kind of. So now go ahead and try. Just stand there like this. Close your eyes for a bit. Take a breath. Kind of feel loose and kind of light. Now just take a step forward and stop. Freeze. Now that's perfect. Now she knows what we're looking for, but that you didn't think about it. No, I didn't. Right, that's good. Perfect. So that worked. Now, will it come back? Good. Good. But at least we know kind of where to start. With you, it was emotions, and with you, it was an upper cervical thing. And start, you go back to what worked before and see, and then maybe it won't work this time. Maybe you get a little deeper, or maybe you have to take it to this level. We had to do 2 cranials. Tired. Yeah. You get some. Make sure you're drinking water. So, any questions on that?
We did. So we tested because cross call made me go weak. So I went into this position while they tested me, and I went weak. And we right after that.
In body, but putting the body in position so it brought that emotion up. So it was randomly body entry to put in the cross crawl emotion.
And
So
you
said
mapped
what
it?
was it? You called it what?
Oh, we just put her in that position because you body entry. So we took the emotion that was being messing up the test.
So you started testing her in that.
Yeah, we put her in that position, confirmed that it was still there, and then approached her that way.
Now, when we were testing her originally, we started out TLing where the dura attaches, and nothing. Did breath in, breath out, nothing. I think it was maybe the 4th or 5th thing we tried was the resist, and that's. And with L, basically, whoever was testing you said that you had a forced inspiration. So that's where we started with that, and then we ended up having to do. So hopefully that was helpful. It was a fun experiment, and next time we'll see, we'll see if it stayed. You walk much? Like you spend much time walking?
Yeah, I try to walk.
Oh, okay. Well, okay. So
Dramatic about it.
yeah, I mean, make sure you're doing this, because normally when we walk, our mind's off. But she was probably walking not necessarily like this, but she was probably just walking like this. You know, I'm not. You know, this is what we do.
If you guys see me walking like that, call me out.
Yeah, so but now concentrate on it. Act like you're walking with your legs. It's like sometimes if you just, your arms, you get the weight of your arms going and then let your feet follow that. And pretty soon it's the only real logical way to walk is to kind of, you come from here and here, you create a torsion, and pretty soon the body starts walking. That's how we're really designed to walk. So we have, let's see, an hour. We have about less than 2 hours. Right? What would you guys feel was the best use of the next 2 hours?
Maybe practicing from yesterday.
Okay. So this, these last couple slides, where's my thingy? You gave me a new thingy. Did I leave it over here? Is it over there? No, that's not. So just. So I made this slide just the other morning. I was just kind of thinking, well, from where you guys are at, how would you approach, either problem focused or just a general eval of a person? And of course, you start with history. Start with postural exams, a great place to start. And then you do your ortho, whatever specific exam. If somebody comes in, they got a shoulder thing, history. Then you're going to do the appropriate kind of range of motion, palpate for pain, ortho neuro tests. Make sure you're, doing kind of mainstream thing first, ruling out a fracture or a frank tear or something like that. And then you start evaluating muscles that are involved with that injury. This is, still once again problem focused. And then somewhere along the way, before you start thinking about treating, you screen them for switching. However you want to do it. You can do the basic, this thing, which is a quick and dirty way. It'll pick up kind of general switching. You can do the thing where a strong indicator, turn the head, still strong, eyes the other way, goes weak. That kind of ties in with the right brain, left brain thing. Honestly, most of the time, if you do this one or you have them do this and test a strong indicator muscle, that's gonna pick up most of them. The ocular lock will clear out most switching. It almost feels like cheating because it gets to the core of things so quickly, but the way it isn't cheating is that you'll clear a lot of stuff that's really valuable stuff to clear, and it will unswitch the patient so you can go further. Now, if they come back every time and their ocular lock is still positive, you're really missing something. Usually, if I'm pretty much on track, the ocular lock findings, which a lot of times a new patient, they're just all over the place. They're just all kinds of switched and wacky. By the second or third or fourth visit, a lot of times I don't find much of the ocular. If I'm onto the right stuff. If it keeps coming back every time it's an atlas, then I'm really missing something. So that's one way to look at it. So you try to it's kind of like taking a screen and you go through, and every time you go through the screen, you pick up a few more, like a fishnet in a pond. You kind of go and you pick up, an old shoe or a piece of moss. And pretty soon, you've gotten all the stuff out of the pond. And then I always, once they're unswitched to a satisfactory degree, or and maybe I might interchange step 5 and 6, sometimes depends, but I look for the big primary gait and stabilizing muscles. I want to see what they're doing, and that's going to be, of course, psoas, glute max, glute med, serratus anterior, lats, abdominals, sacrospinalis, the big players, piriformis. And, once you get good at testing, you can test these things pretty quick. Cover a lot of muscles really quick. Now you've got a baseline. You've got weak muscles that may or may not be associated with a specific problem area, wherever. And you've got bigger muscles too. If you go and they're all wacky with psoas and serratus and a bunch of weak stuff, you need to clear that before you go in and start, really evaluating their injury shape. Especially if it's not an event-related injury. It's sort of like it just developed over time. Hope that's making sense. And then you go back to like the suspected muscles, and you start going in and you're looking for local. Thinking globally, it's kind of gone globally, but now you're coming back globally. Clear those muscles. Basic AK stuff: spindle, GTO, O&I. A lot of times that's what they really need. And honestly, these are the steps. These are the treatments that take more time and energy, more patience. And a lot of AKers don't like to do this stuff. A lot of AKers don't do a whole lot of muscle work. They are always looking for what homeopathy they can give, whatever. They're trying to do the stuff they want to bypass the hard, dirty work of getting in there and disrupting trigger points. But honestly, that's where you're really going to get a lot of good results if you get in. If you don't, send them to somebody who does. If you got a massage therapist that's really well trained and specific muscle techniques, some of them are amazing, and that's what they do, and they'll do it for an hour. I'm going to do it for 2 minutes. Okay? But that I've got some PTs I refer to regularly. They can charge a lot more than I can. Sure. So, and then of course you've treated locally. You go back thinking globally again, and you look at 5 factors. You may not do all this in one visit. You may do this. You may get as far as just unswitching the patient in the first visit, and that's a lot. Nobody else is going to do that. And then the next time you kind of start where you left off. It's kind of like 2 steps forward, 1 step back a lot of times. So there's a lot that this stuff could be kind of moved around. We can add a lot more to it, but this is the kind of stuff I do all day long. This makes up probably 60 to 80% of what I do on patients. That and of course adjusting. If zeroing down, focusing down on just injury-related, event-related things, you're looking for injury sites. Kind of use the term trigger point in a general sense. There's a specific entity that's a trigger point, but a lot of times we use it for all kinds of sore spots. And you look for a muscle that's weak in the clear, and you look for what's going to make it first locally and then globally. That's got a little brighter thing. So you test, you spindle up O&I or GTO, the prime muscle, or the prime muscle that's involved. You test the antagonist for stretch reaction, strong to clear, stretch it, goes weak. That's a muscle that needs fascially reset, fascial flush, and or PNF. Talk about PNF this morning. Everybody's good on PNF. It'd be fun to do a whole class on PNF, but Okay, so once these muscles, and then you test the synergists for two things, really. I just wrote the one thing. But the synergist will often respond to the fold and hold strain, counter strain. Synergist to the primary weak muscle is going to be strong and clear. And then you contract it for about 6 seconds. And then you test it again and it'll go weak. So fascial flush antagonist muscle, strong in the clear, weakens after a stretch. Synergist strain counter strain muscle, strong in the clear, weakens after a 6-second stretch. So it's just the opposite. And the way you treat that is basically you find the tightest, tenderest, the area with the most tenderness, and it's usually the trigger point, and you approximate the O and I so that that trigger point is, and usually the trigger point will be really tender and they get less tender. Hold that trigger point till the body decides to flush it with blood. That's what you're doing with the trigger point. Holding the trigger point, creating more ischemia than it had before, which is probably how it got into trouble. And pretty soon, the brain gets the message that this area is completely ischemic, so it dilates blood vessels in that local area, flushing it with circulation. That's trigger point therapy. Ischemic compression is super effective and super helpful. And that's what you're doing with fold and hold. Doing it with the muscle and slacken. That's the synergist. Now, if you don't do that with the synergist, you may be fine, but then a lot of times that's your reactive muscle. Patient comes back and says, yeah, it's better, but it kind of still hurts when I go through, and pain through its range of motion is going to be the signal that you need to look for strain, counter strain, reactive muscle. Now, reactive muscle, we spindle down. Strain, counter strain, we just hold the trigger point and pulsates. But if it's causing the prime mover to go weak in the reactive, as a reactive muscle, then we spindle out. That makes sense? So once everything is hunky-dory, then you can start looking at 5 factors: Chapman, Bennett, meridian, craniosacral, and of course, nerve supply. Here we go. This is the basic screen for 5 factors. Breath in, breath out, cranial, spinal nerve supply, palpate, therapy, localized, challenge, and I didn't write therapy localized, the spinal level, suspected muscle involved. And then, of course, alarm points, which we'll learn next session. We'll use alarm points, we'll TL alarm points to see which meridian is involved. And then, of course, we TL Chapman and Bennett. So, very basic outline, I guess, for screening for 5 factors. So remember, there's 2 reasons why the muscle is weak. 2 potential reasons. One reason is something wrong with the muscle. Other reason is something wrong with everything else. Everything else remote to the muscle that involves. That's my last slide. So I almost forgot, I want to check, can we do Cole's TMJ? I know TMJ is not this weekend, but you guys find that valuable?
Yes.
We're going to jump on this. So, okay?
Okay, that's great. I'd love to.
I thought you wanted.
Yes.
Tell us a little about your TMJ. Have you ever been hit in the jaw?
No, I wouldn't have even said I had TMJ. You brought it up. But now, this muscle, my master muscle, I'm assuming is like double the size of the one on my muscle.
Have you had any dental issues in the last few years?
Not last few years.
So no trauma, no malocclusion. You bite down, your teeth meet.
I've had a lot of work done when I was a kid, but
Do you have braces?
braces, an extender, and then something that pulls my jaw forward.
Oh, really? Okay. Oh, really? Okay. Like an appliance?
It's a first line.
Yeah, okay.
Corrected,
Yeah, okay. How long did you wear that? You're how old? Puberty?
Yeah. Oh, yeah, I remember. I had an expander for 2 years too before that, and then braces were like.
Oh, okay, so you've been through a lot.
Yeah.
Okay, wow, okay. Okay. Have you had any other trauma?
No.
Ankles, knees, low back,
No, just the one
surgery, the shoulder injury, have you had surgery on the shoulder?
No, but that's the only
You've had-
injury.
And when, how'd you hurt it?
The snowboarding just crushed.
That's right.
Yeah.
So, like that,
It was more so hitting the ground here.
okay. You look at that last session?
We did.
That was a compaction.
Yeah, which
And that's it, no concussions?
I've had multiple.
Okay. Snowboarding?
Well, 2 snowboarding, 1 I used to play rugby.
Oh, great.
Yeah.
Rugby.
Yeah.
You came out with concussion, you didn't break anything else?
No, right? I know.
That means you're fast.
Yeah. Yeah.
Okay, so, are you guys hearing all this? So, but you're pretty healthy. You're not on any medications, I assume.
No medication.
Sleep good?
Sleep great.
Okay. Digestion?
Really bad.
Really bad.
Yeah, I have SIBO right now, and it's been a never-ending battle trying to fix it.
And since you were younger?
This is my 3 or 4 years of having SIBO trying.
So you've done different protocols and.
Right.
Okay, so, yeah, you weren't aware of TMJ, but we brought it up, but something's going on. So, go ahead and keep your shoes on. So here's what I'm gonna do. Here's what I'm thinking. I'm kind of thinking on the hook here. So I want to do the gait test we did originally, see if that brings up anything kind of on a global level. And we'll screen for cranials and TMJ, and I'm going to check your meridians too, just a quick check. Pull off your watch. I'll take mine off. You choose one. Electromagnetic stuff going on. So, anybody else have any thoughts before we start? If you're curious, anything pops up, you think, oh, check it for that. Nobody. Did you have an ICV last?
I did, yes.
Open.
And it was open.
Did it?
It held pretty well after the
It did. Okay.
correction.
Okay, good.
I haven't tested it last week or so, but I think the was good.
Let's have you. Let's just have you stand over there so we can kind of all see your posture. Stands out. And now, when we were doing our step forward, you were a cross collar.
Yeah,
You're okay. So go ahead and step forward with your right foot. Now, step forward, step back, and then step forward with your left. Just kind of watching now. Back. Now step forward with your right foot and stay there. Now I'm going to kind of draw you into more cross crawl. Shoulder up. Good. That doesn't, not good, but I mean, I suspected that. Left foot forward. The nice thing about this is there's all these different muscles that should inhibit. Honestly, the upper trap is neither one of those are turning off, right? They both should. Right? So let's just see if that's whole system. So step forward again. So this lat should do what? It does. Okay. This lat should strong. So that's normal. So forward all the way. SCM is strong. Step forward with the right foot again. Which SCM should turn off?
Right. Right.
Upper trap should turn off. It isn't. Left SCM should turn on. Right? And forward. It does. Okay. Let's try that upper trap again. Shoulder up. It wants to, but okay, come back. Left foot forward. And now right SCM. It turns out. Now let's do the upper trap. Not so much. So what's the SCM and the upper trap, of course, both share cranial nerve innervation and spinal nerve. But the upper traps are definitely not true. So I want to find, because I'm interested in the TMJ, a lot of lateral deviation, maybe a little bit to the right. Now see if you can do this. Yeah. Without your lips, just use the jaw. Interesting. We use those facial muscles. It's really interesting how those kick in. So what's happening with his jaw is his jaw is opening, but it's not. We'd like to see it kind of open like this more. It's kind of opening more like this. So his jaw is one. It's not real bad. It's just subtle. His jaw is kind of going. So instead of just hinging open nicely this way, it's kind of going and then kind of. That's pretty common. You'll see that. So first things first, right foot forward. We're going to see, can you relax your jaw completely? Make it completely slack, shoulder up. That normalizes his upper trap. Left foot forward and shoulder up. And same thing. So if he, come back again, right foot forward, and just very gently bring your jaw together. Box up again. So that's a pretty good example of how that's really running the show. Yesterday you saw that where your muscles were all really strong until you touched your TMJ and then everything. So could we drag that high-low down here? Yep. There's plenty of yeah. Slide. Oh, no, that's it. We're all very great. Wow. Okay, there we go. And we got juice. Is that?
You can go right here. It's right under the.
Just lay flat.
Oh, okay.
I think we just.
Okay, so lay upon your back, please. Now I'm going to be doing some stuff we haven't introduced yet. I'll try to. Who wants to be the keeper of the stuff? So we're going to zero in. You guys can. Yeah, just make sure you can see what I'm doing. Now, relax your back. And push out. Now, he goes into what we call yin with his jaw back. So he's using jaw tension. We all do sometimes. We use jaw tension to sort of amp up our neuronal pool. And so close your eyes. Keep your keep your jaw relaxed. Okay. Okay. Eyes closed. So jaw relaxed, eyes closed. Just checking some stuff here. He's got a C2. Now I'm going to check his pulse points just using regular muscle testing. I'm not skilled in feeling the pulse points like some of you acupuncturists. So I just get on one pair at a time and see if it weakens. He's weakening on the distal hair on his left arm, and that's part of small intestine. So I'm going to have him push down. This is a heart-related muscle. Jaw relaxed, eyes closed. So I'm going to keep treating with his eyes closed because that's where things. So the subscapularis is the best heart-related muscle, and both of his are weak. Now, eyes closed, jaw relaxed. I'm going to make sure he's still, because he was facilitated and he still is. Okay. So when you find the muscle that's weak, the meridian-related muscle weak, go to the alarm point, and that's the alarm point for the heart meridian. Push down, and it turns on. Now, relax your jaw. Make sure I'm not fooling myself. Keep your eyes closed. Now do the same thing. Okay, so that's very central. So he strengthens. Yeah, that sucks out. We'll learn all the specific shoulder muscles next session. So he strengthens to that. Now, so we know the meridian probably needs a little boot, the heart meridian. Sometimes, though, it can be adrenal. Keep your eyes. Yeah, good. Now, can you just touch right here on your adrenal Chapman? The jaw relax. Yeah, so that turns on. Let's go over here. So we know it affects that heart meridian. We know the heart meridian is involved. Let's check. You guys with me?
Yep.
Anybody not with me? Not with me, stop me. I'm gonna. This is how I treat. So. I want this to make sense. Hold there. I'm gonna straighten your leg. Don't let me. That's really good. Jaw relaxed. Good. Okay, so that's good. And that's good. Well, Dr. Wally used to teach that whole there. He thought the gracilis was more related to the cortex and the sartorius more to the medulla. I don't know, when it comes to adrenal stuff. So those are just fine. Okay, so I'm not going to chase down that hole too far, but I want to find out what else turns on that weak subscap. We know this does. We know the adrenal points do. Put your hand over your forehead. And emotions turn it on. Take your hand away, breathe in through your nose, hold your breath, keep the jaw relaxed. Breathe out all the way. So breath in, breath out doesn't seem to
ICV.
too much. ICV is a good one. Enhanced TL. Relax the jaw. Yeah, not so much. Now we could double check ourselves and make sure enhanced TL. We had a strong. That was strong. I know that was that strong before? I think so.
Yeah, it was.
Yeah, it was. Okay. So so no ICV. No. I want you to, since you do have a history of digestive issues, that's Riddler's point. Riddler's point is a reflex associated with hypohydria. Eyes closed, jaw relaxed. That's positive. So does that does that turn on? No, it doesn't. So there's something going on with the stomach, but it's not related to that. Can you? So I'm going to go. Jaw relaxed, eyes closed, better baseline. Now I want you to bite down. I want you to the eyes closed, bite down. Now keep the eyes closed, open big. Bite down. Open the jaw and thrust the jaw forward. Retreat. Lie down. Do you have any tooth issues right now? Any sore teeth? I'm going to test him. I'm going to test him to see if he has good cornea. May or may not happen, but I want to rule that out because typically that's revealed by a bite down. If you bite down, you're triggering the periodontal ligaments, and if there's one that's unhappy, a lot of times you'll get a positive, challenge response. It's like it's a static challenge. Where are those rubber gloves? Are these the large? There we go. Periwinkle. Is that periwinkle? I'm trying to get better. I don't really know different colors very well. A lot of times I'll look at something and it just doesn't. What's that? Yeah. It looks blue and it really isn't, Okay, so I'm gonna have you open your jaw. Bite down. Good. His bite feels pretty equal. Jaw relax. Back and forth. So he's got glide in his TMJ joints. Now I'm just going to use one arm here. Now go ahead and open. I'm going to go up into what's called the pterygoid pocket. That's right where the external pterygoid muscle is. Sorry. And that doesn't show a lot of times. That now open again. I'm going to go into his internal pterygoid, and the right one is internal. So the internal's there, the external is here. Seems like the internal has a problem. I'm going to go into his masseter. That seems okay. I'm going to go into the temporalis. Something going on with that. So it's the middle temporalis. Could be. We didn't check him for that, did we? We also didn't check him for, sorry. We also didn't check him for shear saliva. So.
Yeah.
We didn't check him for switching, which I should have done. It seemed to be switched. That's the shoulder. Does that bother you, the shoulder?
It just started last week again.
Oh, okay. So I could go in and work on those muscles a little bit. But I think we need to check his teeth first, though. So the way I check the teeth, go ahead and open. And a lot of times you can have the patient TL these. I go right at the tooth gum line. I start on the right upper. And I scan about 2 or 3 teeth, and I come through and just look for, okay? Just look for any positive TL.
And this is because of the ligaments from clenching or this is neurological.
What we call neurological tooth. It means that somehow the periodontal ligament is loaded with proprioceptors. And if there's a problem there, the it'll be sending off weird signals. So when you bite down, instead of the brain normally processing that, it creates static disruption. So it will affect brain. One of the things that turns down the tension in the masseters, breaking the teeth, is the feedback from the respect receptors. Now, right here, this is right there at the back molar, we get a positive. Now, I don't want to choke you, but I'm going to go on inside, see if it TL's on the inside too. So there's several there that TL on the inside. Now, he, like me, has had a lot of dental work when he was younger. So I'm going to start with this one here first. So what I'm going to do is I'm going to challenge the tooth just like I would a vertebrae. I'm going to go medial to lateral, lateral to medial. Breathe in. Hold the breath. Okay, so I'm going to correct that. I'll just go correcting as I go. Breathe in. He can feel I'm kind of bending his tooth a little bit. And in breath. So we treat it basically the same way we treat a cranial or a respiratory correction on a vertebrae. And so that seems to have cleared that. Let's go back to this one here. Okay, so I'm going to go medial. So breathe in. Okay, I'll give a chance to swallow there.
That's okay. Good.
I'll go ahead and breathe in again. Let it go. Breathe in again. I used to do it 3 or 4 times. Sometimes I'll feel it kind of give and return. More. I mean, TMJ work can be pretty tedious, but you know, it's like anything. It's, I'm going to the molar just in front of that. Hold there. Breathe in. Breathe in again. They'll challenge a lot of different ways. Your breath. There's times where they literally will challenge if I pull the tooth down or push it in. Good. You get a little break there. And he's kind of, he's got a little adrenal stuff going on. I can feel the kind of the heat.
Oh, yeah, my hands are always sore.
Do you get warm? Do you stay warm easy?
Yeah.
So cold weather probably doesn't bother you.
Still warm.
That's cool. Now, your thyroid's normal?
Yeah.
Yeah. Good. Open. So we're going to go to the lower. Scan. So, sorry. So breathe in. Same thing. Most of them want to go in. Go ahead and breathe in. And get into trouble. Sometimes people have bridges and all kinds of modifications to their teeth. And they're going to test, you know, implants. You know, a lot of people have implants now, and you can test to see if the implants usually don't give people much trouble. I don't find many problems with them. I think they're. I have one. It's just amazing. If all my teeth were implants, I think I could chew a 2 before. So, sorry. Okay, breathe in. Still doing okay? Breathe in again. There's 2. Did you have wisdom teeth removed? Sometimes, believe it or not, the old wisdom tooth area, socket area, can still have a lot of injury recall. Okay, that's pretty good. Take a breath, kind of breathe in and out. That was a lot. It's rather invasive. Now, hands off your body and push out. Good. Eyes closed. Jaw relaxed. Bite down. Yeah, so it's not showing now. Now, open big. That is. Now, I want you to take your TL fingers and put it first right on your masseters. Open big. Okay, now put your TL fingers up on your temporalis. and open big. Wow, interesting. Huh.
Right on that joint.
They're gonna be, yeah, right on, open big. No, okay. Now I want you to take your thumbs and hook them underneath your jaw. This is how we TL the internal terminates. Open big. And that's where we had it. Now take your left one away, put the right one there, and that's the one we found before. It TL'd when I touched it. So there's 2 reasons now for me to go back in and work on your internal pterygoid. Now, when a muscle is a problem with jaw opening, you're putting those jaw closing muscles under stretch. So it's usually a fascial flush situation. The muscle needs fascial flush. So this is a little uncomfortable.
Okay.
I'll try to do as gently as I can. Good and open. Let your jaw relax. I'm going to get on that muscle. Just going to sweep it. Sweep it best I can. Okay? Open again for me, big, and then let it relax.
Sorry.
Almost got me. Sorry, yeah. You got a good one.
Yep.
Eyes closed. And yeah, eyes closed. Just let me test first. Eyes closed, jaw relaxed. But now open big. Oh, okay. So we got lucky. Yeah, that's good. That's good. Okay. Now I want you to bite down again. Bite down. Good. Now I want you to take your TL fingers again, put them on the masseters. This all might seem kind of confusing. There's a whole method to our madness. Bite down. Goes weak again. Now that's going to be the spindle related problem. I need to spindle something down. I'm not sure what. I want you to just do one masseter at a time. Open big. No, bite down. Sorry. Okay. Take your hands away for a second. Bite down. Good. Okay. Now TL. Right side. Bite down. Do the other side. Bite down. So it's the right side I need to spin it down. Now, if I was in my office, I would probably take my percussor, and I learned this from David Leaf. I would put my fingers here and put my percussor right on my palm, and I would just kind of create because it's hard to spindle down a short little muscle like that. A lot of times the percussor is kind of moving those fibers towards the center. Now TL again, please. Bite down. Okay. Now take the hand away and bite down. Eyes closed. Sorry. Once again, go back and TL the masseter, eyes closed, jaw relaxed, and then bite down. Okay, good. Bite down. Protrude. Be true. Jaw to the right. Away to the right. Jaw to the left. Now, once again, jaw relaxed, eyes open, right eye closed. Left eye closed. So let's try the thing again. Oh. Keep the jaw relaxed and the eyes closed. Yeah, so that's back on. That's really back on. Okay, let's see the eyes closed. And that's not showing. Okay, so that's, so we're kind of jaw relaxed. So still need to address so with your eyes closed, roll your eyes down to the right, down to the left. So first you got one snap and then you got another one, right? He's got a sacrum on the left. So we may have to fix that. And then we're going to try the gate thing again. I didn't find as much wrong with your jaw as I thought I might. Just when I'm done. So lay your right side face this way. Okay if we adjust that?
Oh, yeah.
side? Not licensed Americans. Dean, yeah.
That's how it works.
Dean's Dean's name is actually Gary. I'm actually Dean. We were gonna have to tell you eventually. Dean and Dean. So it's just like a lumbar adjustment, but I'm right on the same. And I'm gonna just kind of isolate the tiny, okay? Relax your jaw. There we go, a little more. And we could have done that respiratorily. We probably would have gotten the same. Eyes down, eyes closed and down to the left, because that's how we tested it before. Down to the right. Straight down. Straight up. All right, let's retest your thing. Now, any questions so far? Did I lose anybody? Kind of makes sense. It's all stuff we've, well, no, it's not. A lot of stuff we haven't had, but the muscle testing way we got there should make sense. Okay, so upper trap, just test if you're clear, shoulder up. Strong and clear should be, shoulder up. So keep that jaw relaxed. Step forward with your right foot, stop. Shoulder up. And melts away, just like that. Okay? My shoulder. Left foot forward. Shoulder up. And melts away. So right now he passes the gait inhibition test beautifully. Now lay you on your back for me. We'll just kind of do it. And that's all I would do in this treatment. That's probably twice what I would do treatment. But so make sure that's holding. Bite down. Open big. Now TL your TMJ, the actual TMJ joint, not the master's, but the actual joint right there. Here. Not real hard, just more of a contact. Bite down. Big. Now close the eyes. See, nothing changed. Everything stays the same. That's what we're after now. We could find another layer of challenge. Go out and have you like walking, or maybe so we could do any number of things and retest you, but we'll kind of leave it like that. But what I would send you home with is a couple of jaw exercises. Maybe you know some already, but yoga lion. Most of you are familiar with. That's a great exercise for the TMJ. And basically what you do is you take a deep breath in, and as you exhale, you stick your tongue out as far as you can and open your jaw as big as you can. And it brings a lot of circulation into the jaw. Do it about 3 times in a row. It's very calming. The other thing to do is these kind of classic, where you open and then you kind of push into a fixed object. Kind of isometric, that kind of helps the pterygoid muscles. And then one I really like is have your thumbs on the angle of your jaw, and then you let the jaw relax, then you push forward. That it's like you're translating that joint. And it feels, if you're not, it feels kind of weird. It almost feels like the jaw is going out of place. And remember that the TMJ is a gliding, hinging, translating joint. There's all kinds of motions going on. So when the condyles here are, when the jaw is closed, the condyles are back and tucked up like this. And there's a disc between here and the temporal bone. When you open, the condyles move forward, down, and translate forward. Back up. Back to its seated position. The disc rides with that condyle. The external pterygoid is the muscle that brings that disc forward and lets it back. External pterygoid, high deep with it. If it gets in trouble, it doesn't manage the disc position, and that's where you get popping and grabbing. So your jaw doesn't feel too bad.
Yeah.
I don't think it's near. I think it's in much trouble. It's just neurologically, some patterns have gotten set up in you. So
The pterygoid muscle in the cheek, are you treating external or internal?
that on Cole, it was his internal, and it's back and kind of down.
Is it back there, Cole?
It was back there.
It
was back there.
It's back there. Yeah, it's back there. Both of them are hard to get at. And when I say spindle down, I'm not really. I'm just trying to push into the muscle to get it to kind of release a little bit. External pterygoid, there's two divisions. The top division you can't get at. The lower division you could get on. You can just kind of give it a little push and get it just kind of stretch. And so you're limited as to what you can access in there. But that translation adjustment that I was doing, where I just kind of have you relax and I just kind of keep moving it, a lot of times that will get the TMJ to just find its way home. If it's not a real bad problem, that will reset a lot of stuff. So the protocols that Dr. Francis taught us years ago, which are quite effective, were very aggressive. He would go from 0 to full aggressive, and honestly, I found that wasn't right for, at least for my patients. So there's a lot of real subtle work you can do with the TMJ that's very effective without having to. And bite splints are a great idea, but honestly, the dentists that fit people, they don't muscle test. So, and they fit people, in a position that's different than, So a lot of times I'll have people bring in their bite splints and test them. And often they're fine. They test good, but sometimes they don't. And then a lot of times I'll treat the TMJ and upper circle, whatever I find, and then maybe the bite splint works pretty good. And if it doesn't, then I'll say you need to talk to your dentist. Of course, the dentist, imagine some of their response. This chiropractor said that bite splint is wrong. But I'm not in the room, so I don't know what they say. But anyway, so thank you.
You're welcome.
It'll be interesting to see next session. We'll test you again. See where you're at. Who has his glasses? The community glasses. Okay, so we're at what time? Why am I looking at that?
3:30. So let's practice for an hour.
What's that?
It's 3:30. So
Okay, so you guys want to workshop, and was your husband going to drop by?
someone's here.
Okay, cool. So let's why don't you guys do like free skate for a little bit? If you want to, just you already got ideas, right?
Yes.
We have questions. You got a limbic fixation.
Oh, sweet, yeah.
So we're gonna
We don't
have
know how to fix it.
to.
You're going to fix the limit.
Trust
We know the idea.
correction.
Oh, well, if you need help, let me know.
Yes.
Okay. Anybody else have a specific thing?
Tiana.
Tiana does.
I didn't test for it. I was just trying to test.
What?
And I pressed.
I don't know.
Yes, yeah. And I could test it.
I'm glad.
Workshop bathroom?
We need to talk about what's right, because our things are
Sure you were.
I have a question for you.
What about
I have a question for you.
Okay. I have an answer.
Is that yes? That sounds good.
said 6.
6.
I thought I did that. Never mind. Anyway, what?
So, they can channel. So I'm just gonna do a little.
Demo or like a where we basically teach us what happens.
Yeah, yeah, exactly.
Just buy me talk about it.
Okay, you guys should know. She's actually very down. She was like, as long as
So,
she
I'm
was
wondering,
Really?
she was like, as long as you
this
want
way,
to do it,
this
I'd be
way.
down. So
Yeah.
you are the gatekeeper. I'm gonna go like basically like this huge team. Helping AKs and
Especially here, like, I'm afraid to produce.
It's like now.
so like I don't know if you do it.
So what I'm doing now is I'm moving the head.
Teach us maybe not but I think I'll do that. So like at the right. All the food or something. Maybe down. Maybe down. Maybe down.
I was right, actually.
Good practice.
Clear.
I haven't opened that book since I last time.
Oh, she gave you it.
I don't know, pushy lady. I don't know. Tomorrow? Next weekend, I have a baby shower with my grandson. No. Wait. Saturday.
Just chill.
I'm gonna be hugging up my granddaughter. I'm partying with my grandson. Yeah, you're not. You're cute. You ain't that cute. Charlie's cute. My granddaughter.
Oh, okay. I'm so confused. Oh, okay. When? Charlie! It'll just be us.
Charlie.
What are you guys thinking realistically?
The weekend after.
2 half days or like.
I don't do.
And we could
Say
say
it.
we could do a half day. And then
Literally,
multiple.
we could do it.
I like it. Also perfect.
Some people
So
like
you guys
stretch
keep
that
us-
out.
How about you do 2?
Nope.
How about you do 2 hours and then we practice?
Well, that's what I was gonna say. It's the practicing. It's like,
That's the part.
Test
Yeah.
teach the same way we.
Let's do that. I want to.
I mean, still.
Yeah, we go.
Yeah. So we're thinking next week, not this upcoming week, like 2 weeks from now.
Yeah.
So that March, is that March 7th?
But not this week. Next week. The weekend.
March 7th. Okay. I think I have a baby shower.
But
Wow.
see, she's
But if we
making
did
it.
a morning, I could do that. If we did like 10 to 2 or 9 to 1 or something.
Excuse me, Dean.
Excuse me.
Shut up. You're making stuff up. You didn't know I was gonna say anything.
Yes, I do. Because you're not a morning person. I know it. 100%.
No, I'm not.
Maybe I was like,
It is, yeah.
Yeah, well, you got them all over, it's just the ones that stick out.
Probably not new Monday.
You got one right there. Definitely talking about,
Yeah.
yeah. You wanna be careful with dressing.
and I'm not good. Very good.
They're amazingly tough. I don't know,
Have you been having one?
Oh, yeah.
Last session.
Yeah.
Session 4.
Oh, yeah.
That was my only interaction.
Yeah, she also speaks like into the AK and NET here.
She also has a clinic in town, but.
Are you gonna do this during Washington too? Do you like it?
I've never tried it. Nicole's always offered me, she's like, yep, let's go try it.
Yeah, he's like, let's just do all the things, and I'm like,
Yeah, I mean, it's just like.
what's
It's like a flow.
There isn't, thing is just, what's the word? It's not necessarily. But it is a form of test, right?
Yeah.
Right. But just like this slide up here for this, it's like start.
Right. Demonstrated the
Oh, yeah. How, did you get your living yet? Or?
You know, and then
We're gonna see your technique.
First couple hours, like going through the flow, and then.
Yeah, right there.
Okay, this piece. What's up?
oh,
I'm not sure. It might be right here, but I don't know if she has it up.
I'm back.
You're fast.
That's probably that.
What do you guys want? What do you guys want?
She likes burritos.
Basically, monetary. Maybe you guys want some.
I told her to ask you.
She asked for a favor, so we'll show you.
Now those, I mean, all the
Kind of
small.
We could do it too.
I wouldn't try them.
Yeah, we can do y'all.
I know you said burrito, and I was like, yeah.
Yeah, that's fine if they have to.
Bye. Your tacos. Right. Designer tacos.
Designer taco.
You're like,
Where?
at Bartlett.
Oh, I know what you're talking about. Okay, I've been there.
Cherry. Smoked. Like,
Designer tacos. What?
okay, so should work.
You asked something. What did you say?
Should work.
It's fine.
Work on you.
Which was a out less.
Yeah,
But
I don't know if she is.
That's it.
I have like, I don't know if you can feel it. Same left side. Left side. Slide. So it might be like but or is that actually
It's not
it's like there. Our start there.
do both.
Yeah. I asked for a little bit of help.
Let's see what he's got.
Not move away.
So he's gonna have,
And so then I ended up at home. And
oh, let's do this guy. Yeah. So now, down
Yes, upper. We tested for
But
upper.
feels kind of like
upper lip,
Yes.
on the right side.
Right side.
Let's have you lay on the back.
Like,
unless it's like this. You ever feel like pinching?
Oh, that?
let's go find something.
it's just a little pedal.
Get up. It almost feels
Now,
like weird or something, like pinching, like near my
So,
Almost.
you guys, she has a limbic fixation if you guys want to watch.
like stable. When she comes back, I'll ask her.
Limbic fixation over here.
On aisle 4.
It's kind of like, okay. So, you tested her foot muscles and they were all weak.
We didn't know.
Oh, okay. Well, let's see if she has that.
We just did a TL
Oh, okay.
and then,
So you did the two-handed TL.
and then the traction.
So you did a part.
Right.
And it's the left side.
Uh,
Okay. Right side.
Right side.
Right side. Okay, well, let's test your right. Up there. Hold there. Okay, so that's weak. Hand off the bottom. Hold there. That's weak. Down and in. That's weak. So far, I concur with the height. I concur with the limbic fixation finding. Now, I want you to TL your C7 with one hand and your T1 with your other.
Oh, with the other knee?
Yeah. So double TL, 2 fingers here with your right
On
hand.
C7 and then 2 on T1?
No, on your first rep. Now, 2 things we could test strong indicator muscle to see if it weakens. And we didn't have a baseline, so take your hands away for a second. Push out. Okay, now TL. And remember, it's a fixation, so it may not TL without movement. But it does, in her case, it does. Okay. Now, we'll go.
Sorry, that was my.
No, that's
fault.
okay.
Just keep on
I
loving
felt
it.
I
bad.
never, I always shut Now, I'm going to test these muscles. Hold there. I'm kind of doing a sloppy test here, but idea, curl the toes down. Yeah, see those come right back on. So that, you're totally right. She has a limping. So basically, you can, there's different ways to approach it. You can approach it like a regular subluxation. You go in and just challenge that. Challenge it back and forth dynamically. Go to the first rib, challenge it forward, challenge it back, challenge it forward, challenge it forward and out, and that gives you a real good forward and out. So that's where it wants to go. Now, there are people who do like combo moves, and they're great. You know, I don't really do them. I just never really liked them. So I'm going to adjust the rib this way. It needs to kind of go this way. And I'm going to adjust your C7 away from it. Is it okay?
Yeah.
So I use this kind of contact, sometimes 3, but usually 2 fingers. Get on the rib, kind of move it out and forward, and trying to get it to, ooh, boy, I kind of got loose there. Now I'm going to get on the C7. Remember, it's the first big spinous as you go down. Okay? I got my fingers hooked on it from the left side. And I just give it a move. That's the way I have the best. And then you'll know, put the toes down, push. You'll know if you got it, because these muscles turn right back on. So. Now, TL it again just to be ornery. Make sure we didn't miss something. See, it doesn't show. Move it around a little bit. TL it again.
I also had those like anterior cervicals.
You did?
Yeah. But you might have gotten them with that first
Well,
track.
we got one high one,
Uh-huh.
but the one I was really
Well, my
aiming.
C2 was always stuck.
Yeah, that's right. We got the ones we were aiming for, but we got a couple others too.
Always.
Some, collateral. So, anyway, that's how I do it.
Great.
Yay, thank you.
So we have a guest today, right? That we want to do a little testing on.
Oh, a
What's that?
fresh body.
So your name is
Yeah,
Isaiah.
we are.
what?
Isaiah.
Isaiah. Yes. Sure. So you're okay with us trying, using cert you as a thing? Your wife is saying that she works on you, and you're kind of hard to test. So I want to see if you were hard to test or some ways we can test you. Do you have any injuries? You're a plumber.
Yeah, I guess old. I've fractured my foot. Loose thing.
Your left foot. How'd you break that?
Football.
Which part? Oh, okay. That's a long time ago. So, it's okay if I talk about you here. So, wanted to see, I want to see if I can test it because you're having trouble finding weak muscles and strong muscles. So we want to just use you because all of us are really familiar with this stuff. So you're like out of the wild. So you're like what would be like a real patient.
Yeah.
Who's in your office. So let's just start at the top. We'll look at his posture. You mind popping off your there. Did your puppy come with you?
Yeah, he's right here.
Oh, I won't approach him. But,
He's got his vest on, so
Oh,
he knows
he's
he
all-
doesn't,
he's all
but you can give him a treat later.
oh, okay. Okay, so stand here for me, so everybody, stand with your back to us. We're just gonna take a look at your posture. Arms relaxed.
It just looks his public humiliation a little bit.
What's that?
His public humiliation a little bit.
That's really bad.
Actually, you're not bad. You're not bad. You have to see what we see, of course. So nothing really outstanding here. I mean, hips are pretty level, maybe a tiny bit high. I mean, if we're really split hairs, left foot, a little bit of flare. I'm just not seeing any. The only thing is a little bit of anterior head coverage.
So it's left shoulder, different.
Yeah.
Yeah. Left shoulder is a little
Left shoulder is slightly higher, slightly lower. And, you know, not, you look at the plumb line from here is a little anterior. But if you took his head and brought it back this way, a little bit, you know, it's right up. So that's the fifth pivot point of the 5 pivot points. Right? This being the one that kind of sets it. So you might like push on your hair. If I do anything that's tender or weird, give me a warning before you. For your self-defense tactics. Just feeling general motion here. Actually, you're not bad. His occiput's a little bit tipped and just a little bit rotated. Now that would indicate possibly a tight psoas on the. Would you mind walking for us? Go down the runway there. Go, maybe give us a good stroll. Give us a good sample. Forget we're watching. Yeah, there's. Oh, nice. Tricks. Wow. He's been watching the Olympics. So there's some interesting things going on. Can you bend over and touch your toes? Not bad. It's just that, a little tight, probably in the hamstrings. Do you mind laying on your back? So, oh, that's what. Okay, so we're going to do a couple of. Now, go ahead and push out for me. I'm using a Terry's minor as an indicator here before I know what, the shoulders. This is a push out. See what happens? Right off the bat, we got it. Now that's good because that. Hold that right there. Push up. So hold right here. Straight. Little difference there. That one locks pretty good.
Yeah.
Okay. This one here doesn't. Try it again. Knee straight. Push up. Yeah. Okay. So the right psoas. Now it's interesting. Your head was tipped. Right. A little bit, wasn't it? I think it was. And left shoulder was forward. So I'm going to have you. I have you keep your head in right rotation. Hold that again for me. Push up. Okay, not so much. Let's see what it takes to get that psoas to engage. Push. And that doesn't. So in that position, the psoas turns on. Now I could go ahead and start treating. Let's see if that negates the switching. Is that painful at all? Is that okay? Push. That pretty much negates the page 27. So keep your head like that. Touch some points here. So we got something going on there. Push, push. Push, push. Push. Yeah. So you're really strong. He's really strong. So you got to be really on it. Yeah. I mean, he's got really responsive muscles. Sorry to keep you like that. That keeps you in testable mode. Not detestable, but. Sorry, I grandpa humor.
You're good.
Okay, is that tender? Liver Chapman's not really good. Is the stomach Chapman tender? Tender? Tickle. All right, so I am going to go next to ocular lock. So what shows is the liver gallbladder pulse point. Now we could go down that path here for a little bit. Hold there, push towards that hip. For my testing, push into my hand. There you
Let's see.
go. External. Towards your hip. Okay. Now, just like that. Hold that position. I push away. You go. He's got a weak one. You see how skillfully he tried to come. He went hold. Pushing my hand. See that? But now I've got it. But he was going medial. He was recruiting the upper pack. So that.
Is that the
Oh, and the foot thing?
yeah.
It could be. Yeah, it could be. I mean, yeah, good. Yeah. Okay, so we got that. So first we want to get him out of this position. We want to clear whatever's making that necessary.
And that's switching.
Well, when he goes like this, he kind of unswitches.
Okay.
In this position, he kind of goes back into more of a down compensatory mode.
That's a cervical.
But we kind of knew that already because we saw the anterior. Now have you ever had your neck worked on before?
Did I go get adjusted?
Last week? Is it helpful?
Yeah.
Good. Well, let's see what we got today. Push in. Now, bite down. We're going to screen for TMJ while we're here. Bite down. Good. Open bait. Good. True. Thrust the jaw forward. No, just the jaw. There we go. And now draw it back. I feel like this one. Good. Okay. Now, okay, breathe in through your nose. Hold your breath. Breathe out through your nose. All the way. Hold your breath out. All the way out. Yeah. Okay. So he's got a little bit of baseline there. Okay. Now, half breath in. Full breath in. Half breath out. Full breath out. So we got a sphenical baseline.
I worked on it, but I couldn't get all the way.
Oh, okay. They come back too.
Okay.
Doggone things will come back. Now, so we screen. We think we got a sphenobaselar. We haven't done ocular lock yet. Push in and close your right eye. Close your left eye. Eyes open. Look up to the left. Way up here. So he's showing with occiput on the left. And I want to do a gentle adjustment on your upper neck. I'm going to just do. Hopefully, we can just do it respiratorily. Is that a word?
Sure. We just made it. Yeah.
Respiratorily. What's that?
Said if it wasn't before,
Yeah.
it's now.
So your atlas is lateral right a little bit, and the occiput is a little bit stuck on the left. We're just going to very gently kind of see if this. Figure that one, and then go this way. Relax your jaw. Let it off. There we go. Good. That was tight. Now we'll see if that cleared. Now, close. Eyes open, look up to the left, up to the right. That cleared that. So that cleared the switching.
So it was just occiput?
Occiput and we're a little off. That cleared the switching. Let's see what it did to psoas. Push up. And that's pretty good. Okay, let's go back to the meridians. They're actually pretty darn good shape here. That middle pulse point showed, it still does. And I'm going to push a little deeper. Okay, so that acts like gallbladder meridian. So is there something wrong with gallbladder? Probably not. But let's go to the gallbladder D&E points. gives us, so I'm gonna go to just this side. Just this side. Let's try this side again. So with that, we just did this. We did the, what was it? The TFL and the, okay, so we just did this Palo Alto thing. Let's see. I just have to get a brain fade. It's the last A. It's the we might have to bring the slide up because I'm just blank. But it's bladder. The one I want is gallbladder 42. So actually, if you can bring that slide up, that'll. But I'm just going to go to that point and see. Yeah, see the point at therapy localized. So yeah, there we go for oblique. Push out. So strong glute med. I just touched that point. He goes weak. So for some reason, I don't know. Oh, I know, because the gallbladder B and E point. So I'm going to treat this point right here. It might be a little tender. Sorry. Now I'm going to traction the toe a little bit, give it a little adjustment there. Just kind of open that up. So your ankles have been pretty fortunate. You haven't damaged them much, right?
Not so much.
But this is where you broke it playing football. So that was we didn't do the oblique contra test, but let's just go back here and see if we got it. So now let's go back and see if that cleared the meridian. Did. So let's go. That brings us to the small intestine. Hold there. Push, push. Good. That's a small intestine muscle. That seems fine. So let's go to the subscap. Push down. That seems fine. That seems fine. So I'm not going to chase that too far. We could go on to the Shannon co-cycle, but okay, now push towards this. Good. Take your hand, flat hand there. Bring your hand up here. I'm going to have you sit up and stand right here again. Facing that way. You're being a real trigger here. Hopefully you'll feel better when we're done with it. Now, we still have a head turn. Let a head turn and tippage. But it seems this is a little more comfortable being back over. Does that feel normal to you? Doesn't that feel normal? Okay. So let's test your neck extensors, neck back. Lift your chin. Here, hold you here. Turn the other way. That's all seems fine. Looking for something in the back of the body that we might.
Traps.
Our test is upper traps.
Rotator.
Push back. There we go. Push back. Shoulder up. Turns and good. Bring it back a little bit. Shoulder up. And turns forward. Step forward on your right foot. Stop. Freeze like you're taking a step. Just like that. Bend the knee a little bit. Maybe go a little bit further. I want to exaggerate the gait. Arms in kind of exaggerated position. Shoulder up. Over there. See, we're not unlocking. So come back.
So it's hypertonic.
Hypertonic, yeah. It's failing to inhibit. Bring your left foot forward. And so, shoulder up. Yeah, we're failing to inhibit. So I want you to relax your jaw completely. Step forward with your right foot again. And kind of keep a little bend in that knee. All relaxed. Do the same thing left side. So with his jaw relaxed, he's really strong, but with his jaw relaxed, those should turn off. Straight. Those are supposed to turn off. Lay on your back, please. Are you comfortable with me working on your jaw?
Yeah, please.
Okay. So, are you with me so far?
Yeah.
I think he's not too hard to adjust, but he's not the easiest to adjust. I can kind of see why.
He's very strong.
He's very strong, and his muscles really good at recruiting. So, which is a good, it's a good skill when you're trying to good open your jaw. Big pose. Big pose. His jaw tracks beautifully. I'm not seeing any like weird stuff. It could be there's something going on right here. Half breath in. Okay, breathe fully in. Hold. Half breath out. So he's got a temporal bulge. Now it didn't show up until we cleared this antalgia. So now you guys remember temporal bulge. What's temporal bulge most associated with in terms of pelvic stuff? Temporal bulge, frontal descent, and that one. So, and remember, temporal bulge is half breath in. He was weakening the bilateral PMC, were kind of mushy. They tuned right up as soon as he took the half breath in. So, and I can kind of see it on the left. You guys concur? I'm going to fix the temporal bulge first. I don't know that his category 1 is very much at play, but it could be. Let's have you sit up. We'll test him for that since we're out on time. It's 30 minutes? Okay. Is this helpful? Let's just do a quick scan since we got you captive here. Push in. Good. And scoot over just a hair. Here. Go ahead and push in. Push in. So come forward, about 30 degrees, but yeah, just use your spine. Don't use your arms. Yeah, just bend forward. Scoot back a little bit more. There you go. Now just kind of curl forward about like that. There you go. Push in. So that's normal, kind of. Let's have you sit back up. Put one hand over your right SI, other hand over your left. And then push in. Now take that hand away. Put that hand back and take that. So that's not really showing. Okay, so categories aren't showing. They might show after we fix some other stuff. But go ahead and lay your back. We're going to do a temporal bulge. Do you want to do it? You want to do it? Sure. I'll kind of help. Is that okay?
Yeah.
Can she do it?
I mean, you're here to fix it, so yeah.
Yeah.
Just mess it up.
Well, if she's going to, I guarantee she's going to get her done.
He's gonna walk me through it.
So you can test by challenging each side and testing, but I can tell you right now it's probably on this side,
On this side.
on the left side, where your left hand is.
Okay. Actually, I can kind of.
So what I would do is test his actually I'll test and you do the challenge, okay? All right.
It's just static, right?
It's going to be a rebound. So you come over here like this. You're going to challenge him.
Okay.
This way. Actually, no, you're going to get right up here. Give it a squeeze. There you go. Give it a squeeze, 2 or 3. And I'm going to use a different muscle. Okay, ready? And now I'm going to test. Hold. So that's a positive. Now, do it again. Half breath in. Hold the breath. Okay. So that's going to be your correction.
Okay.
Okay. And I would correct that on inspiration. I would correct that and then just go over and just pull it right on the stem up. 3 or 4 breaths. And actually, let's see, maybe hop up for a sec. What I would do is I would get here and get down here. That way you've got good power there.
This.
Yeah. Get your palm right on this.
Oh, I
On
see.
this
I can feel it.
There you go. Now, go ahead and breathe in. Nice and slow. And as he breathes in, you just follow that in. And then as he breathes out, you take the picture. In breath. Breathe out.
That was 4.
Okay. Now go over here and just, here, I'll show you how to, over here, put this hand over here, and just cradle his head. Take this thumb and wiggle across the sacral suture. Rip that upper bone and just yeah. Just like that. On and exhale. About 4. Bye. Okay, well, let's just see if he's tuned up here. Good. Okay, half breath in. Full breath in. Half breath out. Full breath out. He's clear. Good job. Okay, now let's test the gait again. He's chilling.
He is.
He's ready for a nap. Good stand. Now, this is still tipped a little bit, honestly. Now, does that feel kind of normal? Doesn't feel terribly abnormal. Just feel a little normal. So, honestly, some exercises that would help you would be things like being a fulcrum, like with fingers like this, or even like an owl or something. And just kind of pull them forward while you contract those muscles. Kind of hold it for like 3 to 4 seconds. Like an isometric, when you're translating the vertebrae the way they need to be while you're moving. That can help kind of follow up. But see, that's a great stretch. And if you add this to it like this, and just hold it like that. Yeah, so you're kind of on the like this. All of your work is like that, all day long. So now let's upper track, shoulder up, head over, and hold. Strong in the clear, shoulder up. Strong in the clear, lat. Right knee is elbow straight. Hold there. Here, roll that in, straight. Those tendons kind of taking up slack there. Good. Okay. Now, step forward with your right foot and bend the knee a little bit. Keep weight on both feet. Up, turn a little bit, we'll exaggerate it. Shoulder up, over, hold there, and see he melts away. Well, he doesn't exactly melt away. He does inhibit. Back, left foot forward. Like I say, it could be nice, it could melt away nicer, but at least the first time we did it, it was just long, like yours was. So would you just walk for us? Just relax and just let yourself go. Um, um, so sit on the end for me. And do it okay? Your knees together. I'm going to ask you to just sort of twist back and forth here a few times. We're going to test your abdominal muscles. There we go. Good. Now bring your arms like this and keep your knees together. So I'm testing you guys, but I'm testing his right rectus. Knees together. And that's not so good. Hold there. Left rectus, not so good. Okay, so do that again for me. Knees together, turn this way, and I want you to take a deep breath in and hold the breath. Breath. Okay, that's better. Breathe out. Breathe in again. Hold the breath. Deep breath in. Hold the breath, hold the muscle. Okay, that's kind of better, but what am I thinking? Sagittal suture, right. Breathe in and let it go. Breathe in and let it go. Breathe in and let it go. See you next time. Breathe in. Breathe in again. Good. I'll try that again. Forward and turn slightly. Hold. Oh, that's better. Hold there. There. Okay, turn this way. Pushing you back. And that's pretty good. 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 So I'm going to ask you to do one more thing. I want you to walk like this. Just exaggerate. Walk. Get your arms this way in. And feeling the grip. Just walk this way. And now let this part of your, there you go. Just let it go. Let it go. Let it go. Relax your jaw, relax your breathing. Different. Shoulders moving. Torso moving. Let's try this again. Step forward with your right foot. Bend your knee. Turn this way, shoulder up. Over. And it's about the same after you. So laying your back. So we talked earlier, I think today earlier we were talking about this exercise. Hold your knees together for me. There, hands down and stabilize on the table. I'm going to push you this way, you resist. Now turn this way. But this is how I kind of tell. If people can hold these okay, then I'll give them the exercise. If they can't, then I won't. Keep your knees together. I want you to do these motions. Don't let the shins droop. You got a platter with a bowl full of water and you don't want to spill it. Go the other way. I'm just going to kind of guide you. Good. I'll set this up. So I'm trying to get these abdominal muscles to expand their repertoire. Go this way. This way. So stabilize here and then you do it. Don't let the platter spill. Go the other way. Good. Come way over. Stabilize, then go way over. Good. And way over. Way over. See, this is something you can do just at home, just while your coffee's brewing in the mornings. Now walk again for me. It's kind of free walking. That's a little smooth, a little soft again, doesn't it? Yeah. And that's a lot for now. That kind of took him from here to maybe here. So we'll just check the hams here real quick. Hold there, hamstrings, good. Push, push. And hold there. Push, push. Good. And then bring this up here. We'll check his glute max. And that's not as happy as I'd like. Okay, bring this up here. Hold there. Push up. And that one's better. Now, I could start searching up through the sacrospinalis group, get all the way up. But I'm going to start down here and just see if there's anything here that might be part of that kinetic chain. Because we're running out of time, so I got to pick my battles. Is that tender there?
Yeah.
Yeah. Yeah, he's got some, definitely. Now I'm just going to give, this is a navicular, there we go. And navicular was a little bit stuck. And we'll see if that affects that glute max. And this, which leg did you, foot did you break? This one? Okay. Try that again for me. Push, push. Oh, yeah, there we go. Now bring this up again. Push, push. Oh, yeah. That's actually, that one was the better one, and it's, yeah, that's good. Now I'm going to do something. You doing okay?
Mm-hmm.
Bring this up here. Now I'm testing his glute max and his hamstrings, kinetic chain testing. And that's pretty good. Try that on this side. This is how the body really works, right? It works but easy, and that's pretty good. Now let's have you come all the way up. Hold that there. Push into my hand with the ball of your foot. There you go. Hold that right there. Hold there. And then there we find a weakness. Try that on this side. Bring it up. Push, push into my hand. Follow your foot into my hand. And that side's pretty good. So the kinetic chain is not fully functioning on this side. It's better on this side. And his cuboid is kind of stuck. You okay? Wish. Hey, oh, Al, are you still got your activator handy? Did Kayla get her? She didn't get her manual.
We can get it.
Yeah, good. Those things aren't cheap. I don't want to lose. I should bring one, but I'm always concerned it's going to hold up my luggage. So, okay, let's try this again. Bring it up. Hold there, push it in the ball of my foot. I'm going to stabilize it. Push down, push, 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 push. Okay, so let that, now I'm going to go up here and see if I'm missing something in the other parts of the kinetic chain. Push, push. Yeah, okay. So it's calf. So I'm just treating the trigger points the quick and dirty way with the activator. Should be one right in there. Okay, try that again. And push into my hand. Ah, there we go. So walk again, please. Just a nice free swing and walk. What's that?
Then it looks less stiff.
Yeah, there's a little more flow. Well, maybe we should have just had you walk a bunch. Maybe that would have been done just as much. Now that's got a little more flow to it. So that's a lot. Make sure you drink plenty of water.
Yeah.
So upper cervicals, we kind of started with that to get his head back, and then we spent, let's see, what else did we do?
Occiput.
So occiput,
Spinal base alert.
abdominals were kind of, yeah, didn't find much in the pelvis. Push. What?
The cranials,
Sagittal suture.
temporal,
Temporal bulge, okay, temporal bulge, bridal set, those were big tickets. We'll just see if that, step forward with your right, stop, and then kneel. Still tight, still kind of tight. Now relax your jaw. Yeah, a little bit of jaw tension, hold on, step forward with your left. Just hang. It weakens, but it's really, yeah. So your mission, is to practice when you're walking, practice letting this area because you're kind of walking without turning. Probably because you spend your days kind of bracing and stuff. So those muscles get used to that, and then when you're not working, they're doing, I'm exaggerating. That can really help. Just things like this, just kind of listen. If you've been working for a bit, take a couple of seconds and just kind of do a few things like that. Do these things, lots of them. Thanks for bringing that in. I appreciate giving us a chance to
Yeah. New body, I guess.
experimenting on a real patient.
Yeah.
Is that, you guys, was that helpful? Hopefully it will be at the end.
Are you wanting to sign our sheets?
Oh, does everybody have their sheets?
No,
We didn't sign them last time.
I don't have it this time either.
Need a new sheet?
I think I need a new sheet. I don't even think I've ever.
You
had
did sign them last time. Only for some of us though. I got mine signed last time.
Okay, so look at these guys. These guys have their sheets.
If I can remember, that would be great.
So next time, everybody bring their sheets. If you don't have one, Dean's got them or Elle's got them on, right?
Yeah, I can make copies real quick.
Dean, can you make me? I don't know where it's
what
at.
are the dates? Dang it. The last one was
Yeah.
Thank you.
Oh, I think I got your pen. Yeah.
Oh, yeah.
Sorry.
Thank you. Your paper? Yeah.
You know, if you worry about losing those sheets, take a picture of them, you know, with your camera, and that way we can make a new one.
I lost mine, so do I need to have you re-sign it all?
I don't. Just make sure I sign them before the end of the
Okay.
class.
All right.
Because I have to submit these, you know, the ICAK. So this is, okay.
Thank you.
Oh, do I get to, say hi?
Okay, sit.
Oh, look at you. Ooh, it's- oh.
So fluffy.